Hi, Dr. Turowski here. I would like to talk to you about the procedures that are one of the most popular procedures in my clinic. I typically perform several of these every week, so they are really popular, and they're not only popular because I do them, but they also address problems that affect most of the moms out there. These are so-called mommy makeover procedures, and a lot of you already had kids. For some of you that didn't have kids, you may need them in the future, but for those who already went through the pregnancies and deliveries, you may find out that you have changes in your breast, in your tummies that are really not what you expected from life. Some of this can be addressed by diet and exercise, and of course this is important. Everybody should try that. But for those who have changes that are not addressed by diet and exercise, surgery is the only option. Typically, we do these procedures after the deliveries are over. So most of these procedures are performed after you already finished with the kids. You already have your 2, 3, whatever number of kids you want to have, and then you address the problem. However, some of this can be addressed earlier, like breast procedures can be done between the deliveries. If you want to address small breast size or hanging breast, that absolutely makes sense to do it between the breasts. Tummy tucks are usually recommended after the deliveries, although I have patients that are in their 20s, they deliver a child, they will not deliver another child for 10 years. They should address it. They will live through their 20s looking good instead of not looking good. So if they decide to have another child, we can always address it in the future. Maybe they don't need anything in the future. So it's not set in stone that you have to do it when the kids are here. It can be done in a different situation, and you certainly should discuss it and what kind of a procedure can be done. Briefly, I will talk about what can be done. For the breasts, you have two problems. Either your breasts are small, and then you address it as a breast augmentation, and please refer to yourself to the breast augmentation page, which discusses that procedure. It can be deflated breasts that can also be fixed with just the breast augmentation, or can be too bigger breasts. If the breasts are too big, then you need a breast reduction surgery. So again, please go to the breast reduction page, and then you will have information about that. Or can be a breast lift surgery, and here we're going into two different procedures, either just lift or lift with the implants. I will discuss it on the breast lift page. So since there are different options here, I don't want to go over all of this here. You have to refer yourself to the pages that talk about that. Now for the tummy, again, there are several issues here. You can have loose abdominal wall, loose abdominal scale, and you can have excess amount of fat. Here we can perform either a liposuction alone, very unusual in patients who already deliver their children, because the skin is usually stretched out more or less. So the skin has to be addressed. It can be addressed with the J-plasma procedure, which is a minimally invasive skin tightening. It can be addressed through the mini tummy tuck or full tummy tuck. Again, please refer to the appropriate pages and you'll find yourself descriptions of these procedures. One word of caution here, we are actually able to perform these procedures together as long as you are healthy and you are appropriate candidates, so this can be discussed. You can send us photographs if you're not local. You can send me photographs over the internet, and then I can discuss with you what type of procedures are for you and what is the best way to make you look better for the rest of your life. Because what's important about these mommy makeovers is that as long as you don't gain a lot of weight, you're going to have for life improvement. So think about this 40, 50 years that you have to be on the beaches with your kids, with your retirement. You may as well address it now and enjoy it for the rest of your life.